Well, good afternoon, and thank you for coming for this important announcement. Residents, law enforcement personnel, healthcare workers, and city officials all agree. A health crisis is best dealt within the healthcare system rather than the legal system. Today, we are proud to announce a long-in-the-works pilot program for a clinician-led community response team. When they launch this coming summer, they will act as the third part of a three-pronged effort to increase access to mental health care for residents who find themselves in crisis. The first two are already underway, and they are our Mobile Crisis Assistance Teams, or MCAT, and the Assessment and Intervention Center on the campus of the Community Justice campus. This new clinician-led team will differ in a couple of important ways. First, while police are always ready to provide backup, the clinician-led teams will be a non-law enforcement response. They'll be made up of one mental health clinician and one peer specialist. And at full capacity, they will operate 24 hours a day, 7 days a week. Second, these teams will be activated through a new set of criteria at 911 dispatch. Once teams are on the scene, they will de-escalate, address the immediate needs, and prepare a sustainable care plan going forward. That's the goal here, a path to a better, healthier life outside the criminal justice system. We are here today with many, many partners who stand before you today. That's because this effort has broad support throughout this community. So my thanks to everyone who has made this pilot program a reality. That includes our City County Council, who passed the $2 million funding in our 2023 operating budget. That includes our Metropolitan Emergency Services Agency, who will deploy the teams. It includes Stepping Stone, LLC, who will contract the mental health professionals. And of course, it includes community groups who advocated for this program, like Faith in Indiana, who was an early, if not earliest, collaborator. Our ambition for better access to mental health care in Indianapolis does not end here, does not end today. But it is a critical step to ensure residents who are ill will be cared for and not incarcerated. For bringing us this important effort, I want to give special recognition to the former and current heads of the Office of Public Health and Safety, Deputy Mayor Lauren Rodriguez, and our next speaker, OPHS Director Romy Bernard Tucker. Romy?
Thank you again, Mr. Mayor. I am thrilled to stand here today with many of those who have played a vital role in making this program a reality. As the mayor mentioned, this first in its kind program holds incredible promise. It will allow us to engage with residents during their time of need, providing the specialized care and support that is essential to their well-being, and fitting directly into the mission of the Office of Public Health and Safety. We are honored to add to the new clinician-led community response team to our behavioral health division at OPHS. And we are deeply grateful for our implementation partners at Stepping Stone Therapy Center. Stepping Stone has already begun the recruitment and training process for the team members who will be serving in this program. The initial response teams will operate out of the city-county building as emergency responders triggered by downtown district 911 calls that meet the criteria outlined by MESA and our consultants. Chief Sellis, along with our consultants, have begun training his talented team of dispatchers to identify a mental health crisis call, and as long as no weapon is involved, this new clinician-led response team will be dispatched. The team will include a clinical supervisor, a licensed clinical social worker, and a peer specialist. As we work to reach full capacity for this program, the initial schedule will be made up of 4 teams, working 3-day, 10-hour shifts with hours varying, depending on the volume of the calls. Call data will continue to be collected and analyzed to ensure the full efficacy of this clinician-led community response team. Once on scene, the clinician and the peer will evaluate the neighbor in need from their clinician van and will make informed clinical decisions to transport the individual either to the Assessment Intervention Center, the AIC, or a hospital or their home. We are proud to announce that transportation within Marion County would come at no cost to the individual who is being served. MCAT will operate as a backup to this team, and clinicians will have access to the radio to call for additional support, such as ambulance, MCAT, or IMPD. At full capacity, this will be 24/7, so 24 hours, 7 days per week, with teams responding to calls in the IMPD downtown district and eventually the IMPD East District. We cannot say thank you enough to the Office of Mayor Hogsett, the County Council, Stepping Stone Therapy Center, the Phoenix Nicholas Center, Moving Forward LLC, Community Solutions, Faith in Indiana, the dedicated members of OPHS, and our invaluable community stakeholders for their commitment to this resource. By diverting mental health crises away from unnecessary entanglements with the criminal justice system, our city is taking a significant step forward. And it's a step toward a more compassionate and effective approach to public safety. This vital source and resource will ensure that when individuals reach out for help during a mental health crisis, they will receive compassionate and informed assistance right from the start. As Mayor Hogsett mentioned, this is an expansion of our emergency response to empower our dedicated mental health professionals to lead the way. Again, thank you, Mayor Hogsett, for your vision and your willingness to listen to the community. And thank you, Stepping Stone, for the important work you're about to do. And with that, I'd like to introduce Andrea Brown with Stepping Stone. Thank you.
Thank you, Romy. Good afternoon. My name is Andrea Brown, and I am the Director of Operations for the Clinician-led Community Response Team and previous Associate Director of Stepping Stone Therapy Center. Thank you, Mayor Hogsett, the Office of Public Health and Safety, the City County Council, and all other important community partners. Stepping Stone Therapy Center is a double minority-owned business, and Stepping Stone Therapy Center began in 2015 with the vision to provide quality mental health care to any and everyone, regardless of your socioeconomic status, what side of town you live on, or your race and/or ethnicity. Our goal has always been to promote the well-being of families through prevention when possible, intervention, education, and advocacy. Our vision has been to help both children and adults live their lives to their fullest potential. At Stepping Stone Therapy Center, our practice has always been to meet people where they are at. We are honored to be the mental health agency that forms the clinician-led community response team. The city of Indianapolis and the mental health community are ready for this shift in how we as a city address mental health crises. Stepping Stone Therapy Center is here to provide behavioral health services and connect fellow Hoosiers to other community resources as needed. There is a lot of work to be done surrounding mental health. There is a need for a more progressive and individually centered approach to assisting a person with mental illness, and Stepping Stone Therapy Center is excited to be a part of that shift, and we are ready to do the work. Thank you all so much, and with that, I will introduce Bianca Harris, founder and director of the Phoenix Nicholas Center and organizer of the Black Church Coalition.
Welcome, everyone. My name is Bianca Harris, and as a licensed mental health therapist with 15 years of experience in the state of Indiana, as well as an organizer with the Black Church Coalition, I have dreamed of the day that I could have a non-policing crisis response option for my clients. Having a system that my clients can access without police intervention that could end up irreversibly altering their lives is not only a need, but it's a priority. I am grateful to Mayor Hogsett and the Office of Public Health and Safety for the state's first fully funded clinician-led crisis response team, the CLCR. This is the first step in revolutionizing mental health access and equity. The city of Indianapolis is reimagining its mental health landscape. This means that those that are suffering through mental health crisis can actually receive support through trained professionals instead of criminalizing mental health. March of 2022, after hours of listening sessions and hundreds of community members, the Black Church Coalition held a public action where we relayed the community's concerns to Mayor Hogsett, and there he responded with yes to piloting the CLCR. This is the first of its kind in a city that had no infrastructure to support a program on this scale. This has been a collaborative project that community leaders and are co-creating with city officials. The Black Church Coalition has been working diligently alongside Stepping Stones, city officials, and across multiple disciplines in creating infrastructure and systems that have not previously existed. We are not only able to reach people in need, but also, as one of the highest paid mental health positions in the city, we hope to reach the highest quality clinicians for the residents of our city. The CLCR is currently in the process of hiring quality clinicians to staff this team so that when we officially launch, we can ensure that we are meeting the needs of the citizens of Indianapolis to the best of our capabilities. As a mental health therapist still actively seeing clients, it warms my heart to know that the city of Indianapolis has taken this step in reimagining fully funded and equitable mental health practices for its residents. This is the first step in the mental health revolution, and I'm excited to see it come to fruition. We as community leaders plan to continue to work in conjunction with city officials to continue to expand mental health crisis response services for all residents. Thank you for your time, and I would like to introduce City County Counsel John Farr.
Good afternoon. Today's announcement of the Clinician-led Crisis Response Pilot Program will allow us to transform how our city responds and supports to people experiencing a mental health crisis. That is why, as the District 7 counselor and a member of the Public Safety Committee, I am proud to stand here today alongside my colleagues, Vice President Zach Adamson and Councilor Jared Evans, Mayor Hogsett, and all our community partners for this announcement. This pilot program has been a long time coming. During my time on the council, I have done several ride-alongs with the IMPD, and it allowed me to get a better sense of the types of calls that our police officers are responding to day in and day out. One thing that stood out to me was the number of mental health related calls that they receive and respond to. While I am grateful to our IMPD officers who respond to the many calls of people in danger, we put enough duty and responsibility on our law enforcement, and a clinician-led response team will be better equipped to meet the needs of people experiencing a mental health crisis. That is why my colleagues and I in the council have been advocating for a non-emergency response team since 2020. and it has been a priority for many of us. And we were proud to support and approve $2 million for the pilot program last October. How we respond to folks experiencing a mental health crisis says a lot about who we are, and the pilot program is a step in the right direction as we look to respond in a more compassionate way. I would like to thank Mayor Hogsett, Deputy Mayor Rodriguez, Director Tucker, and our community and service providers for coming together to show an extraordinary commitment to what is a critical goal, ensuring that our neighbors are not suffering in silence and that recovery is possible. And I'll just close with a personal note. As noted in my formal comments, I've been on multiple IMPD ride-alongs. In fact, when I was reelected coming into this term, I right away did an IMPD ride-along. It was a third shift overnight, and that night I couldn't believe how often we responded to mental health related crises. In particular, substance abuse. The need for substance abuse treatment is very significant, and folks who, if they got consistent ongoing treatment for mental health issues, would be able to have much better lives and would support their communities in a much better way. So this happening now is really exciting, and again, I thank all our community partners for making it happen. And now I'll bring back Director Tucker.
Thank you, Counselor. All right, now it's time for questions, if you have any.
When you guys say unnecessary entanglement, can you further describe what you mean by that?
Sure. So with the clinician-led community response, what you have is a licensed clinician going to someone to help them. They're not engaged, they're not law enforcement, they are not part of the criminal justice system. They're really someone who's going to help this person's mental health needs and will be able to direct them, like I said, to the AIC or hospital or home.
Okay, so avoiding any need to perhaps lead this person to go to jail or things like that may just be unnecessary, essentially.
Yes, the clinicians will basically just be catering to these person's mental health needs, and they don't have any arrest powers or anything like that.
And I have just another question from my end. Hearing you guys, it's difficult to not think about Herman Whitfield. And so his mom called asking for mental health help. And so with this happening, do you guys see a more positive future to avoid any other incidents like that occurring? And I know it's pending litigation, but it's difficult to not think about that.
Yes, certainly we cannot comment. Like you said, it's pending litigation. We cannot comment on this, but certainly we're hoping this program to have a positive impact on our city and the people that we serve. Every time that a clinician can help someone, it is going to be positive. It's going to be good for Indianapolis. So, thank you.
I have a question. Obviously, many people in Indianapolis can recognize MCAT. We talked about MCAT. You guys mentioned MCAT. Can you speak as to what MCAT's role will look like differently now that this is being put into place come this summer?
Yes, absolutely. So in terms of the 911 dispatchers, the way that they are trained, any call that involves a mental health or behavioral health crisis, so either mental health or substance abuse, as long as it's not an imminent threat to that person or the community, it's not a safety concern, no weapons involved, the clinicians are gonna be the one leading it. So they're getting dispatched to that person to help them. Now, if there is a weapon involved or there's some sort of safety threat, then MCAT would be the one responding, because obviously we want everyone to be safe. Now, if it's outside of the operating hours of MCAT, IMPD, myself have to be involved. But the point is to get people the help they need in the most safest, I guess, way possible for everyone.
You said launching this summer. Do you guys have a rough timeline on when you think this will kick off?
July 1st, hopefully sooner, but yes.
And Indianapolis, then you said, is going to branch out to the east side.
Yes, the East
Any
District.
plans to spread it through other subparts of the city?
Yes, I mean, we hope that if it goes really well, and we have all the reasons to think it's going to be going well, we will definitely expand that, so.
And then once at full capacity,
I think a couple more.
how many people are you thinking on the team once you reach that full capacity?
So at full capacity, we're looking at 36 people. Yeah.
Mayor, could you speak to, obviously, your hopes that this will bring to the city. I know you spoke on it a bit, but we see oftentimes so many people calling on you guys to step up and help our people with mental health. What is it like, or how does it feel to you to be able to play a role in this?
Well, it's deeply satisfying, although I say that understanding that there's still a long way to go. But I think that given the efforts that have been made by our collaborative partners, their expertise, their experience, bringing to bear a commitment from our Office of Public Health and Safety, as well as IMPD. I think there's been a tremendous amount of cooperation and collaboration. We want to minimize as much as we can any glitches. I'm sure there'll be a few as we implement it, but I'm very proud. It's long overdue and much needed. And it's why I'm so proud of the MCAT initiative, why I'm so proud of that the first building that you encounter on our community justice campus is an assessment and intervention center, a building designed to give people the treatment that they need and to keep them out of jail. I mean, at its most effective, it is turning people who would otherwise simply be incarcerated, no questions asked, probably not receiving any treatment while incarcerated, into truly addressing the core issues involved.
Your message to families who might have to make that call, it could be for anyone who wants to answer that.
Great.
I think in its core, this program is a community-led program because what I would imagine is most of those calls are going to be coming from a third party. You're going to see someone who needs help and you're going to make the call. And the information that you're going to be giving to the 911 dispatcher is really what's going to save this person's life. So I think it's a very exciting moment to live in Indianapolis now because we're getting people the help that they need.
So, $2 million for the pilot program for 2 districts. Have you done any estimating about what it would cost to fully fund 24/7 care throughout all the IMPD districts, say including North District?
I don't have a specific number. We certainly are going to be working on our budgets later this month, but I don't have a number to give you. I'm sorry.
Fine. Thanks, guys. Appreciate it. If you have any follow-ups, we can, back you with everybody else. Thanks, guys.
Thank you.